I had a lot of male patients that were coming in asking for specific things, but they were all of the same genre. It had to do with liposuction, defining their abdomen, and flattening their chest or making it more defined. So just creating the term Macho Makeover and be able to describe what they were looking for in simpler terms.
Welcome back to our second episode with Dr. Luster here at Avana Plastic Surgery. In this episode of Under the Microphone, we are going to be discussing the Macho Makeover with who better than Dr. Luster, who coined the term. Which brings us to our first question. Dr. Luster, what inspired you to coin this term? And can you tell us a little bit more about the procedures that fall under the Macho Makeover?
Well, the term kind of came about fairly naturally. I had a lot of male patients that were coming in asking for specific things, but they were all of the same genre. It had to do with liposuction, defining their abdomen, and flattening their chest or making it more defined. So just creating the term Macho Makeover kind of encompasses the lipo 360 with ab etching, fat transfer to the chest, and liposuction of the sides of the chest. So it was just an easy way for men to kind of reference the procedure, have like a touch point for it, and be able to describe what they were looking for in simpler terms.
Brilliant. Now, how do you approach creating a natural masculine look in male patients in comparison to female patients?
Well, with all liposculpture procedures, everything's based off of the patient's anatomy. So depending on what their goals are and their desires, we use their anatomy, their anatomical features to help define their musculature, give them a nice V shape. So over time, if they maintain their weight, then their results stay. And if they build muscle in place of where the fat is, it's anatomic to them. So it looks pretty natural.
Phenomenal. Now, fat transfer versus chest implants for men. What are the key differences and how do you help patients decide which option is best for them?
Well, with all foreign bodies, like an implant in the chest, there's a potential for you to have a capsular contracture. I've seen it a few times in different male patients that have actually come for removal. However, I don't really do chest implants at all. I strictly do fat transfers. I find it to be a little more natural. It looks more subtle and it just adds a little extra definition without a foreign object. So drains can sometimes be a point of contention for patients because why would you want something hanging out of you if you don't have to? However, every surgeon's different. I find that placement of drains is very beneficial in helping drain the fluid out that we use for tumescing during the lipo procedures. It helps prevent seromas. When you get your post-op massages, it helps facilitate the drainage as well. And I place 2 of them, 1 on each side, so it's even. But everyone has their own techniques.
Fantastic. Now, what is one misconception about male plastic surgery that you'd like to dispel?
Well, I think sometimes maybe in the past men were a little bit more hesitant to get plastic surgery as to not looks vain or whatever the biases were towards plastic surgery at the time. But now people focus on their health, their mental health, their confidence, their fitness. So if you want to jumpstart something and produces a journey towards like health and fitness that encourages you and makes you feel more confident about yourself, like I'm all for it. And men, I think, are on board this train now, and it's awesome.
Phenomenal. Thank you so much, Dr. Luster.
Thank you so much for tuning in to this week's episode with Dr. Luster for Under the Microphone. We are so excited to have you tuning in to this very cool new series here at Avana Plastic Surgery. And please don't forget to subscribe for more. Also, guys, don't forget to follow us over on Instagram and TikTok, where you can see so many before and afters, including those of the Macho Makeover from Dr. Luster. However, we have over 10 plastic surgeons here, so please keep up to date with us over there, because we also announced the next episode for Under the Microphone over on Instagram. All right, so looking forward to seeing you guys on the next episode.